Dear students, let us continue with the discussion of bioequivalence studies or in vitro bioequivalence studies. Uh, so let us discuss the circumstances under which we have to go for the conduct of in vitro bioequivalence studies. First one is if the two drug products differ only in the strength of their active substance, same active substance, provided all the other conditions holding the same, or all the providing all the other all other criteria or conditions holds same, like the linearity of pharmacokinetics of the drug. Since same drug is used in two products, pharmacokinetics of the drug will also be same. And if the drug shows, if the pharmacokinetics are linear in nature, if the pharmacokinetics of the drug are linear in nature, and if the qualitative composition of the drug products is same, if the qualitative composition of the drug products is same, if the nothing but if there is if the ratio between the active substance and excipients is same, and the ratio between the excipients used is same, and same excipients are used in two drug products, and if two drug products are produced by same manufacturer at same manufacturing location under same manufacturing conditions using same manufacturing facilities, and if already a bioavailability or bioequivalence study has been performed on the original drug product. Here original drug product means the drug product that is that okay that will be taken as a reference standard for conducting the in vitro bioequivalence studies or in vitro dissolution studies. And if the two drug products shows same dissolution rate under the same dissolution testing conditions, okay, we have to go for the conduct of in vitro bioequivalence studies. Okay, subjecting to all the criteria just now I told you, we can go for the conduct of in vitro bioequivalence studies or in vitro release or dissolution studies. Whenever the manufacturer performs a slight reformulation of the drug product, or manufacturing method, whenever he changes the manufacturing method used for making the drug products slightly in a manner that not affects the bioavailability of the drug products, then it is sufficient to establish, it is sufficient to go for in vitro bioequivalence studies to establish the bioequivalence between the drug products. And when the drug product is a solution dosage form, like a syrup or a tincture or an elixir containing the active ingredient, same active ingredient in the same concentration, and not containing excipients known to significantly affect the absorption of the active ingredient, it is sufficient to conduct in vitro bioequivalence studies instead of in vivo bioequivalence studies. And if an acceptable in vitro in vivo correlation is available for a drug product, and if the in vitro dissolution rate of n- new product is equivalent to that of already approved medicinal product, then it is sufficient to conduct in vitro bioequivalence studies instead of in vivo bioequivalence studies. And finally, when the drug product is intended for topical administration for local effect, when the drug product is for oral administration but not intended to be absorbed systemically like an antacid, when the drug product is administered by inhalation as a gas or a vapor, then then also it is sufficient to conduct in vitro bioequivalence studies instead of in vivo bioequivalence studies. Okay, so till now we have discussed various circumstances and various criteria for different situations where the in vivo bioequivalence studies can be substituted with in vitro bioequivalence studies. Okay, so this is all about the introduction to bioavailability and bioequivalence. Okay, now let us move on to the next topic, that is bioavailability study protocol. Okay, what is mean by protocol? Protocol means a plan, a predefined plan of action for performing any task. This is called as a protocol. Okay, the aim of bioavailability study is to find out the dosage form influence on biological performance of the drug. This we already know, and therefore the bioavailability study protocol that is used should have enough sensitivity to detect the differences in the rate and extent of drug absorption that are attributable only to the dosage form variability, and should avoid variabilities due to the other factors. Nothing but whatever the bioavailability protocol or bioequivalence study protocol we create or develop should be able to should have enough sensitivity to detect the differences in the rate and extent of drug absorption from the dosage forms or from the drug products selected only due to the variable only due to the differences in the formulation or variabilities in the formulation, and not due to the other factors and not due to the other factors. And here we have to remember some few things, that sometimes due to inherent properties of the drug, analytical difficulties are encountered that will preclude the measurement of the drug or metabolite levels in the body fluids. So the other techniques are used to assess bioavailability. The drug may be labeled with a radioactive tag, or a pharmacological response or clinical response may be measured, or the studies may be carried out uh, in a in the animals, in the selected animals. Mean mean to say that it may not be possible to conduct bioavailability or bioequivalence studies always in human beings. Sometimes we may have to perform the studies in animals. Sometimes we may have to perform these studies by measurement of pharmacological or clinical response of the drugs. Sometimes we may have to perform the study after radioactive tagging of the drug under study. So all these are the alternatives. Okay, if we are unable to perform these studies in a usual way, we have to go for all these alternatives. So let us see the components of or contents of bioavailability study protocol. Okay, we have mainly four contents in a basic protocol, that they are study objective, study design. Under study design, we need to discuss the significance of various factors. Okay, because by taking into account various factors, only we'll select an appropriate experimental design for conduct of bioavailability or bioequivalence study. So all the factors that are necessary to decide an appropriate design will have to be discussed, and these factors includes experimental design, the nature or type of experimental design, the uh, n- the the washout period or the necessity of washout period, the types of drug products used in the study, like test products and approved products, effect of route of administration, the dosage regimen selected, uh, to be given or to be administered to the subjects during the study, the frequency and duration of sampling, the randomization of drug administration, the importance of single versus multiple dose studies, and various aspects of subjects selection, like whether it is good to select healthy subjects or patients, under on what basis we have to select the healthy subjects, what's conditions to be followed during the study, etc. and etc. And finally, the aspect of analysis of biological fluids, or the effect of the analysis of biological fluids in selecting an appropriate study design. So all these factors need to be discussed, and we'll be discussing all these factors and, in our forthcoming discussion. And this and the third content is the methods of assessment of viability. So we have basically four methods for assessing the viability. They are using plasma data, using urine data, using acute pharmacological effect, and using clinical response. And the last content of the protocol is analysis and presentation of the data obtained. Nothing but statistical treatment of the data obtained. Okay, we'll obtain the data of the approved drug product as well as new drug product, or the two drug products that are to be compared in using our study. So which statistical measure or which statistical analysis we have to use How to present that data? Usually, ANOVA is most commonly used for statistical analysis of the data obtained from the study, and other non-parametric tests are also used, like t-test, chi-square test, etc., depending upon their relevance. Okay, so this is about this is contents, various contents of the protocol. So let us stop at this point and continue with the next video. Thank you.